Thank you for introduction. Hello everyone. This is my COI. First of all, neuropath rotigotine is one of anti-Parkinsonian drug and act as dopamine receptor agonist with high affinity for dopamine 2, 3, and 4 receptors, but with lower affinity for dopamine 1 and 5 receptors. Recent studies show that D1 and D2 receptors and overactive bladder relationship, and they show that a D1 agonist inhibited detrusor overactivity, whereas a D2 agonist facilitated detrusor of overactivity. Therefore, D1 and D2 have opposite effect on micturition reflex. Aim of this study was to investigate the effect of rotigotine, which is dopamine receptor agonist with affinity for D2 and D1 receptor on micturition reflex in PD rats model. And we used SD female rats 12 to 14 weeks and hemi-Parkinsonian model rats injected with 6-hydroxydopamine in lateral striatum. And we measured following parameters such as intercontraction intervals, ICI, and avoiding pressure, BP, and residual urine volume. And we conducted two different routes of injection. One is intravenous injection, and the second is subcutaneous injection. And we assessed that all parameters in those following groups. And as a result, an intravenous administration of rotigotine in PD model, and we found that intercontraction intervals and avoiding pressure and significant decreases in those groups compared to vehicle injection. However, subcutaneous administration of rotigotine in PD models and intercontraction intervals significantly increased in those groups compared to vehicle injection. So, in discussion, IV rotigotine administration shortened CIC and VP, and which is supported by the studies showing D2-like agonists shorten the interval of micturition reflex, and also transdermal rotigotine administration significantly increased in CICI in PD model in our experiment. So, which is also supported by the study showing what D1-like agonists prolong ICI. And we also conducted additional experiment to show the effect of D1 agonist and using D1 antagonists. And after subcutaneous rotigotine injection, and found that after D1 agonist, ICI significantly decreased. So, in conclusion, the current study provided corroborating evidence that overactive bladder was subsided by administration of rotigotine in PD model, and also transdermal administration route is crucial for the control of micturition reflex due to property of dopamine receptors. Therefore, transdermal administration of rotigotine could be effective to improve not only motor symptoms, but also overactive bladder in patients with PD. Thank you so much for kind attention.
Congratulations, nice work. There is any answer from the auditorium? So, in your mind, you used two ways. One was transdermal and the other one. What do you think is the best to control, to have a benefit?
Yes, and in our experiment, we found that subcutaneous and transdermal injection of rotigotine significantly increase interval contraction intervals and in PD rats. So we think that subcutaneous injection, which is transdermal patch, and usually in clinical settings, they use a transdermal patch on the skin. So I think this is the best way.
So I'm quite struck by the very dramatic effect of your model on your cystometrogram and the dramatic normalization after the dopaminergic treatment. And as you're emphasizing the clinical relevance, I find that your quite dramatic results contrast totally to the clinical experience that when you treat Parkinson's disease, it has almost no effect at all on their lower urinary tract dysfunction. Now, I'm hoping that what you're demonstrating will translate into the clinical setting. But do you feel optimistic?
Yes. Actually, recent studies published in 2017, and they conducted study in clinical settings, and they found that bladder capacity and also first sensation and yes, these are urodynamic parameters significantly improved in patients. So
but they're quite subjective urodynamic parameters. We need some very strong conviction. So I hope you can convince us with further progress.
Yes, and we will.
It would be lovely.
Yes, thank you so much.
Thank you. No other comments? Thank you. Oh yeah. The man that knows.
Yes. Sakakibara from Japan, and thanks very much for your very interesting results. And could you show us about the putative mechanism between the different behavior between the transdermal and the intravenous?
Yeah, thank you so much for your question. And maybe we need more further investigation, but at this time we found that the phenomenon of an intravenous and subcutaneous injection, D1 and D2, like dopamine agonist behavior, are a little bit different, and in terms of urodynamic parameters, but the key underlining of pharmacological mechanism on micturition reflex is, I think, that blood concentration, and there is so in intravenous injection reached to the peak of blood concentration slowly, and whereas subcutaneous injection reached to the peak of blood concentration faster than others. So I think this is one mechanism, but we need clarified a little bit more on pharmacokinetics parameters in future studies.
Okay, thank you. Leave us the hope to have a new treatment for our Parkinson patient. So we move to next one.